So good morning, everyone, and welcome to Houston for those of you who are coming from afar. As the organizer and sponsor of today's event, I'm thrilled to see so many faces that I know and as well as new folks that I hope to talk to and meet today. The diversity of this gathering with people from all over the world. I think the winners of the furthest is Australia, our Australian guests. But we also have Chile, Mexico, Argentina. We're really thrilled that you all are here to share your experiences and expertise. Today, we'll talk about how we can bridge the gap between research and practice, and particularly in global settings where we often experience a lot of challenges in bridging that gap and where we often see the greatest inequities. We'll focus on turning implementation science methods and theories into real-world tools that can make substantive and lasting change. Because global implementation science isn't just local or regional improvements, it's about creating models that can be locally adapted to diverse cultural and socioeconomic contexts. And it's about learning from other countries. We all have different systems, we all have different influences that determine whether innovations get adopted, implemented, and sustained. And there's much that we can learn from each other. So our sessions today are really exciting, and they include topics on global implementation science challenges and opportunities, practical implementation science, funding global implementation science research, implementation science in Latin America, global implementation science in cancer control, building capacity, a really important topic, build knowledge and skills to actually do implementation research and practice in global settings. And then our closing session will focus on implementation science and health equity. So today is about collaboration, innovation, exchange of ideas, and I encourage you to ask questions, talk to each other on the breaks, see if we can collaborate and forge pathways to increased knowledge, understanding, skills, capacity to address the many, many issues that confront us in terms of bringing research and innovations into the real world to improve health and health equity. So we are going to start our program, and I would like to introduce Dr. Kevin Morano, who's a Senior Vice President of Academic and Faculty Affairs, to give a welcome from our institution.
Okay, thank you, Maria. First, can I see a show of hands? How many of you in the audience are from out of town? Wow, fantastic. Fantastic. Sorry about the weather. Not always quite so dramatic. But on behalf of President Colasurdo, let me welcome you all to this event. We're really excited to see this happening. And I just want to spend a couple of minutes to tell you a little bit about UTHealth Houston. So we are part of the greater University of Texas system here, one of the largest public university systems in the country, 14 campuses. This university is composed of 7 schools, and each school has been around for various lengths of time. They all came together a little over 50 years ago. In that time, we've grown to have a current student enrollment of about 6,000 students, about 2,500 faculty. And the total UTHealth Houston is about 20,000 individuals. So it's a large and impactful research university. We're also fortunate to have a major clinical presence with 2 major hospital partners in town, as well as our own clinical practice plan. That translates into about 2 million patient encounters every single year, which we now understand is a fantastic laboratory for everything that you all are doing, working in implementation science, trying to translate research, new findings, et cetera, into process and practice in clinics, and of course out in the community through the School of Public Health, which I'll be hearing more about soon, and through our global health initiatives, which I think you might also be hearing a few words about in a few minutes. the university's got a strong commitment to implementation science, and that's evidenced really in two major ways. One is our not so long ago recently founded Institute of Implementation Science. That's co-directed by Maria and by Bijal Balasubramanian here in the audience. And that institute is charged with bringing those schools together, trying to get investigators doing different things in different contexts to work together to future the goals of public health and implementation science. Moreover, both of them are part of the president's executive team, charged with doing the same thing on a larger level, statewide and also nationwide. So I think we've got a strong commitment to implementation science. Just from listening to the agenda, it sounds like you may be talking about implementation science a little bit throughout the course of the day. Have a wonderful time. Enjoy the science. Enjoy the networking. If you can stay in town through the end of the week, I think the weather might get a little bit better. So enjoy Houston. It's a great, diverse, and fun city. So welcome once again. Thanks to Maria and her team and everybody for putting on this great conference.
Thanks so much, Dr. Morano. And now we'll hear from Dr. Eric Boerwinkle, Dean of the School of Public Health.
You are definitely being welcomed. Yeah. So good morning, special good morning to you. So it's my pleasure to welcome you to Houston and the Global Implementation Science Conference. I'm proud to be and honored to be the Dean of the UTHealth Houston School of Public Health. For those of you who don't know it, it's the 4th largest school of public health in the country, and it's ranked in the top 10 in the country. And so I'm very proud, many initiatives within the school. Today, in particular, our Institute for Implementation Science. The vision of the UTHealth Houston School of Public Health is to have health without boundaries. Public health is the cornerstone of a thriving communities and societies. It transcends borders, it transcends cultures, and it transcends ideologies. Emphasizing that health is not just an individual concern, but frankly, a collective responsibility. Global health research using implementation science is critical to accelerating translation of evidence into public health practice. It brings cutting-edge translational science to equitably improve health outcomes for individuals living with a host of communicable and non-communicable diseases around the world. I'm thrilled that the Institute of Implementation Science, co-led by Drs. Fernández and Balasubramanian, is collaborating with the Global Implementation Science Society in hosting and supporting this conference. Our institutional leaders, including myself, recognize the importance of implementation science to bridge the gap between research and practice. And this commitment does not stop at any bound. I'm confident that the speakers and the talks that have been curated for this conference will be thought-provoking and forward-looking, providing you with knowledge and tools to build stronger health systems and foster resilient communities in order to create a healthier, more equitable world. Thank you for being here. Thank you for your dedication and for commitment to the global health. Let us make the most of this conference, forging connections, sharing knowledge, and igniting actions that will produce health without boundaries. So thank you for your attention, and please enjoy the meeting and your visit here today. Thanks.
Thank you so much, Dean Boerwinkle. And now we'd like to hear from Assistant Vice President Kristina Tebo, Assistant Vice President of Global Health Initiatives.
Thank you so much. I'll echo my colleagues in welcoming you to UTHealth Houston and to this conference today. I've been working in global health for nearly the last 2 decades. And yet it was to my shame that I just learned about implementation science a few years back. And ever since learning about it, I started to see it pop up all over my work and all throughout literature, and I couldn't believe I had been blinded to it up until then. But I was just recently reminded of how important good implementation is. I was working with some colleagues of mine in Africa, and we were mapping out typhoid fever cases. And we were having a lot of difficulty with contact tracing because most of our patients didn't have addresses and there were bad map systems for the region. And as an aside, as we were struggling, one of my colleagues said, oh, well, the government actually created a really robust addressing system for the entire country. Everyone has an address through this governmental system. But unfortunately, that addressing system was never well advertised and never fully adopted by the population. And so very few people knew about it and were using it. And that's just a poignant example of how crucial good implementation is. We can have these wonderful ideas and these new clinical practice guidelines and life-saving treatments, but if we don't implement them well, they won't have the global impact that we're hoping for. And so today, as you learn more about implementation science and share your own work and expertise, I hope you enjoy the conference and really start to forge partnerships that can advance global health further. Thank you so much.
We'd like to welcome Francesca Infante, who is the GIS board president, to say a few words about the Global Implementation Society. Welcome, Francesca. Can you hear us?
Yes, I can hear you. Good morning, everyone. Buenos días a todos, a todas, for those of you who are from Latin America and speak Spanish. The Global Implementation Society started in 2011, and with a group of members who decided to bring global implementation, all the research that was being done, first to create a collaborative, and after that to kind of like bring implementation science or translate implementation science or bring implementation science to scale to all the world. If you can move to the third slide with the map. There, that's the one that I wanted to show you first. The Global Implementation Science then. So we are a group of colleagues from all around the world. You can see it's 300 members that come from different parts of the world that are organized. We have a board of directors where Maria belongs and Helen belongs as well. I think that Sergio from GIS Latam is also attending this conference. But we organize ourselves in hubs from different regions, and as well we organize in different sectors. We are practitioners, researchers, and policymakers who come together to share, talk, and talk about what are we doing, how we can improve, learn from each other, and so on. So that's what I wanted to show you first, our map of where we located. We started with 2 members of the Global South in 2011, and now we are almost half of the members. So we can really say that we are a Global Implementation Society. If you can go first, please, to the first slide with our mission, our vision. I hope I could be there to see you. I know great people are participating. Well, never mind, move to the next one. Never mind, if you move to the next one, you can visit our website. You're gonna learn our values that are diversity, inclusivity, to being respectful. Equity is a main value of our society, of how to really listen to that and create and implement, to apply implementation science in different regions, different contexts, and make sure we are promoting equity, accessibility, for enhancing accessibility to everyone with network products, services, and lifelong learning. And what we provide as a society, we have a journal. So those of you who write, we open, please send your articles, not that fast, one backward. We have a research implementation and application journal. We have a professional learning resources and opportunity. If you get into our website, you will see all the different resources you have. We have tools for implementing in our own practices. And we provide all the support to creating local networks, either at the country level or at the regional level. We have several benefits for becoming a member. So again, you can visit our website if you move to the next one to learn more. But I would say that the most beautiful thing of the Global Implementation Society and what really brings us together is that we're all working with similar issues in different parts of the world. And the Global Implementation Society provides us this platform for making connections, from learning from each other, and from moving implementation science forward, either at the research level, at the advocacy and policy making level, or at the practice level. And just to wrap up, like you have there our website. We have a big conference coming up in November in Nigeria in collaboration with the Nigerian Implementation Science Alliance. So you're all welcome to come to the conference, to join the conference, but most of everything, to join the Global Implementation Society. Thank you so much. And I send you a big hug from Chile, and especially to my colleagues that I wish I were there with you. Big kiss.